Alright, we're going to pick up where we left off with Chapter 12, talking about immunity. There's two types of immunity. Immunity can be innate or adaptive. Innate immunity is a series of non-specific physical and chemical defenses. This is identical to general combat response to a pathogen exposure or pathogen entry. It does not distinguish between the type or the identity of the pathogen. Whereas adaptive immunity, this is where there's a specific reaction to a specific antigen of each individual pathogen that invades your body. Antigens are special substances that can provoke an immune response. We've mentioned antigens before when we talked about blood type. This is also going to help with distinguishing self from non-self or self from foreign. So in other words, all of your body cells have a little name tag on them that say, "Hi, I belong here." And then the bacteria cells that come into your body have little name tags on them that say, "Hi, I'm trying to destroy you." Those are the antigens. So this animation here goes through the correspondence between the lymphatic system and disease resistance. Let's talk about those antigens more specifically. They are immunogenic, which again means they are going to produce an immune response. They can be the entire microbe or just a chemical component on the cell membrane. They induce those plasma B cells to secrete antibodies. The word antigen actually stems from antibody generator, antigen. So an antigen is going to generate antibodies. They're going to induce the manufacturing of antigen-specific cells that kill those antigen-incorporating cells. So in other words, these antigens are going to set out a full-blown specific attack on that invader. This animation here goes through the relationships between antigens and antibodies. Let's talk about innate immunity. This is your body's first line of defense. This includes physical barriers that prevent pathogen entry, such as skin, mucous membranes, and other body fluids. Your skin, as we mentioned, is multi-layered. It's the top layer of your body. It's continuously shed so that it maintains its integrity. Those mucous membranes line those body openings, trapping microbes and foreign substances within your nasal cavity, within your mouth, etc. This includes nasal hair, the cilia, and the respiratory tract, which all helps to propel the debris upwards and out of the body. It's called the mucus escalator in your respiratory tract. Kind of a cool word. There's also other body fluids that help wash pathogens away. This includes saliva, tears, sweat, and even urine. There's also chemical barriers that can prevent pathogen growth, and this is found within the body fluids and on the skin. Sebum, or oil, is on the skin. It helps to form a protective barrier on the skin. It also has a antibacterial property to it. Lysozyme is a special antibacterial agent breaking down certain bacterial cell walls. It's found in saliva, it's found in tears, it's found in nasal secretions, tissue fluids, it's found in sweat, it's pretty much in all of your body secretions. The gastric juice in your stomach has that very, very low pH of hydrochloric acid, mucus, and enzymes to help destroy bacteria and toxins before they become absorbed through your GI tract. Vaginal secretions also provide a innate immunity. Your vaginas have a very acidic pH to discourage bacterial growth. Let's talk about some of the specifics here. You have skin. The epidermis is that physical barrier to microbes. Hairs within the nose help to filter dust and microbes, and the eyes secrete those tears to dilute and wash away irritants and microbes. So this is a blend of physical barriers as well as chemical barriers. The lysozyme, the acidic film within the sebaceous glands, those would be chemical barriers. The physical barriers are the hair, the mucus, the epidermis itself, as well as the fluids that are washing those pathogens away. Within the digestive system are those acidic secretions. There's also the reflexes of vomiting and defecation to get rid of microbes from the body. The vagina has those acidic pH to discourage bacterial growth, and urine flowing down the urethra helps to wash microbes away. So again, here we have the physical barriers of the secretions, the urine flow, vomiting and defecation, and the chemical barriers of the acidity of the gastric juice and the vagina. Let's talk about the second line of defense. This includes antimicrobial chemicals, such as something called complement. Complement proteins form special holes in the microbial membranes. This is going to attract phagocytes to the sites of the infection. There's interferons, which are proteins produced by the immune cells. These immune cells are then going to migrate to the infected cells and interfere, hence the term interferon, interfere with viral replication. So this is going to stop a virus from replicating within your body cells. There's also special iron-binding proteins. These proteins are going to inhibit the growth of some bacteria by making iron unavailable. There's also antimicrobial proteins, which are small little proteins that will kill microbes and attract immune cells to the site of the infection. There's also phagocytosis. That's that eating or Pac-Man-like action. Phagocytic cells like macrophages and those, the word is escaping me right now, those dendritic cells. Sorry, I had a mind blank there. The dendritic cells and the macrophages, which are eating large particles like bacteria. Complement is going to help in that process as well. There's also inflammation, which is your body's natural defense response to tissue damage. That's going to dispose of microbes, toxins, foreign substances, as well as preventing their spread. Inflammation is also going to play a role in preparing that site for tissue repair. The signs of inflammation, we're all familiar with it. The redness, the pain, the heat, the swelling, that may cause a loss of function in that particular area until healing ensues. Fever is another innate a factor of innate immunity. This is having an abnormally high body temperature because your hypothalamus has been reset. This can occur during infection as well as inflammation. This diagram here goes through some of the innate immunity factors that I went through. Complement, which is actually a fairly complex process. You just need to know that complement proteins from the blood will activate to form holes in the membranes. You don't need to know all of these kind of intermediate steps of activating the complement. Interferons, again, are interfering with viral replication. Those antimicrobial proteins killing the microbes and attracting special immune responses. Those iron-binding proteins reducing the amount of iron to inhibit the growth of microbes. You also have the phagocytes, T cells and B cells, specifically the monocytes, the macrophages, neutrophils going through and gobbling up cellular debris and foreign particles. Inflammation itself, which is when those special cells called mast cells, blood platelets, basophils release a protein called histamine. Histamine is going to dilate the blood vessels, increase the permeability, so lots and lots of blood cells can get through and clean up the area. It's also going to draw special white blood cells to the area via the process of chemotaxis. Basically, those white blood cells will kind of smell out the injured tissue and all migrate to the area. Kind of an interesting idea. Macrophages will eventually die, forming that fluid we call pus, which gets destroyed and absorbed or forms a pustule on the skin surface, depending on where the damage was. The fever is another second line of defense, as we mentioned, and this is from a substance called interleukin-1. The high temperature is going to ultimately enhance the effects of interferons. It's going to also inhibit the growth of microbes, as well as speed up metabolism, which is going to then speed up the repair reaction. So fever can be a good thing. This animation here goes through non-specific disease resistance. Let's talk about adaptive immunity. We've talked about innate immunity. That's the immunity we're all born with. Adaptive immunity is combating specific bacteria, specific viruses, and specific antigens. Adaptive immunity is quick responding. It can remember previously encountered invading antigens. It can distinguish between self and non-self. There are two types of adaptive immunity. There's cell-mediated and antibody-mediated immunity. Let's first look at cell-mediated immunity. Cell-mediated immunity is when the immune cells attack infected or dysfunctional cells. Those immune cells mediate the immunity. The T cells are the main attackers in cell-mediated immunity. T cells are made in the red bone marrow and then mature in the thymus gland. That's actually what the T in T cells stands for, thymus gland. So that's where they're made. These are going to combat intracellular pathogens, including virus, bacteria, and fungi-infected cells, as well as cancer cells, foreign tissue transplants. The list goes on, but this is more at a cellular level, looking at specific cells. Whereas antibody-mediated immunity is going to involve the B cells. These are the main cells in the action of this type of immunity. These B cells are made and matured in the red bone marrow. This is effective against extracellular pathogens, so viruses, bacteria, fungi that are in the blood and body fluids, not those that have already invaded our cells and tissues. So there's an interaction between the cell-mediated and antibody-mediated immunity. So when the antigen invades the body, it replicates and produces many copies of itself and spreads through the body tissue and fluids. Some of those copies are found in the body cells and others are found in the extracellular fluid. So in this way, cell-mediated immunity and antibody-mediated immunity need to work together to combat the invading pathogens. There's a couple phases to adaptive immunity. Phase 1 includes the production and maturation of the T and B cells within the thymus and red bone marrow. Those cells are then going to migrate to the secondary lymph organs, such as the lymph nodes. The T and B cells are still inactive. They kind of wait behind the curtains, so to speak. Then phase 2 is when the T cells become activated by special cells called APCs, or antigen-presenting cells. These include macrophages, dendritic cells, and B cells. This is going to lead to what's called clonal selection, which is the differentiation of these inactivated T cells into active cells and special cells called memory cells, which will then remember this antigen for the future. Phase 3 is when the B cells become activated and cytotoxic T cells, which are just a subset of T cells, will also help as well as the helper T cells. B cells and cytotoxic T cells then undergo clonal selection, which again just means they're going to differentiate to form those memory cells. Phase 4 is when the cytotoxic T cells kill the infected body cells. B cells differentiate into plasma cells, which secrete antibodies for that antibody-mediated immunity. So phase 4 is kind of the ultimate step here in adaptive immunity. This is when you get the cell-on-cell attack and antibody-on-antigen attack. Here you can see the whole process kind of drawn out. So let's take a look at it. Phase 1, T cells and B cells are developing. They're going to migrate to the lymphatic organs where they remain inactive. So, phase 2. Specific antigens are presented to the helper T cells. That's going to activate them. Those helper T cells divide and differentiate to form memory T cells, and that's what you see here. You have some memory cells being developed, as well as active cells being developed. In phase 3, there's active cells, as well as cytotoxic T cells, and now B cells coming into play. They're going to help differentiate and proliferate into more memory cells. Kind of say, hey, okay, we want to remember you for the future, just in case we're attacked again. It's our body's way of kind of planning ahead. Then phase 4 is when those cytotoxic T cells perform cell-mediated immunity, which is where they're going to attack each cell either through phagocytosis or secreting special enzymes to break those cells down. The B cells are going to differentiate into those plasma cells, which secrete antibodies. Those antibodies are then going to attack those foreign antigens. So there's something that we need to mention at this point that's called an MHC, or a major histocompatibility complex. This is a unique set of proteins in every body cell except for the red blood cells. This is very specific for the individual. This is kind of like a molecular fingerprint. It's essential for the T cells to recognize the identity of those antigens. B cells can recognize the antigens, but T cells cannot. T cells need the MHC antigen complex in order to work properly. So an APC is an antigen-presenting cell. This is a cell that ingests, processes, and presents that foreign substance on its cell membrane. Dendritic cells, macrophages, B cells are all going to respond to these APCs. These are present in the skin, the mucous membranes, and the lymph nodes. They're kind of waiting there to find these APCs and attack them. So foreign antigens then become bound to the MHC proteins on the antigen-presenting cell, and they're moved and presented to the T cells. When that MHC antigen complex is presented to the T cells, special chemicals and proteins stimulate that cytotoxic T cell. And that's when that cytotoxic T cell undergoes what's called clonal activation, which is when it will secrete those memory cells so that it can remember this antigen for the future. When that MHC antigen complex is presented to the T cells, those T cells will then destroy that MHC cell. So the MHC antigen complex is something that forms on those cells that have been taken over by a foreign particle. It's basically that cell's way of saying, help, I've been attacked. And what does the cytotoxic T cell do? It kills it. Here you can see the function of the antigen presenting cell. So you have some type of foreign antigen coming in to the cell. The cell is going to phagocytize it, gobble it up. It's going to digest the antigen into fragments. It's going to form what's called an MHC, that major histocompatibility complex, and it's going to present that foreign antigen on its cell surface. So this is that little flag that says, hey, I've been invaded. There are invaders and bad cells in the area. You need to kill me, and you need to kill all of the other cells that have this antigen on it. The cytotoxic T cell will release something called granzyme. This is a protein digesting enzyme that triggers apoptosis. Apoptosis is programmed cell death. This is where that cell is basically going to fragment and fall apart. The cell becomes destroyed, it releases the microbes, and the microbes are killed by those phagocytes, those little Pac-Man cells that float around eating debris. Perforin and granulysin are other enzymes that are released into those infected cells that are going to help destroy microbes and cause that cytolysis or cell bursting. Here you can see the whole process of T cell action. So you have that APC cell presenting its antigen. You have that helper T cell saying, whoa, I recognize you as something that should die. That helper T cell is going to form those memory cells, which are long-lived, and they will remember that major histocompatibility complex and antigen, and it will be able to attack much quicker in the future. Those helper cells are then going to basically differentiate, as I mentioned, into those cytotoxic T cells. Those cytotoxic T cells will then release the granzymes, or possibly the granulysin and perforin. Either way, the cell is destroyed and the foreign antigens are destroyed. I think I went backwards. Oops, I am going backwards. Sorry about that. There we go. Cell-mediated immunity is diagrammed out in this animation for you. Let's talk about antibody-mediated immunity. So we'll talk more about B cells now. Some of the B cells will help with those T cells. Helper T cells can stimulate activated B cells to go through that clonal activation. Those memory B cells will then be produced very quicker when the antigen is presented again. Plasma cells, remember, produce antibodies. So here you have the antibody-mediated immunity. You have B cell activation when that B cell displaying processed antigen is recognized by that helper T cell. That helper T cell is going to stimulate those B cells and say, hey B cells, you need to activate, you need to undergo clonal selection, where they'll form memory B cells, and they'll start to form plasma cells. Those B cells will form plasma cells, which secrete antibodies. Those antibodies, which kind of look like Ys, they're large proteins, they're going to bind to the antigens on the foreign particle, on the foreign cell membrane, and they'll immobilize the bacteria. They can neutralize the antigen. They can clump together, which is what happens with our blood types. If you recall, it's called agglutination. It can activate complement, which can kind of call in the troops, so to speak, to destroy the cells. It can attract phagocytes to enhance phagocytosis. Ultimately, either way, these antigens are going to signal the end for this foreign body. This animation here goes through the antibody-mediated immunity. Let's talk about immunoglobins. These are the special plasma proteins that we call antibodies. The technical term for antibody is immunoglobins. There's 5 different types. Antibodies can be in a T-shaped or a Y-shaped, and they can bind to identical antigens at the same time. They're specific for a particular antigen. So kind of like an enzyme and substrate, antibodies and antigens are specific as well. This diagram from your textbook goes through the different types of immunoglobins: IgG, IgA, IgM, IgD, and IgE. IgG, this is the majority of our blood cells. This is the type of antigen that is going to cross from the mother to the fetus. This is going to provide immune protection for newborns. IgA, this is what's found in our sweat, in our tears, in our saliva, in breast milk. So this is why breastfed babies have a better immune system, so they say, than formula-fed babies. There's also IgM. IgM is the first class that's going to be secreted after initial exposure to an antigen. In the blood plasma, the anti-A and anti-B antibodies in that ABO blood group is going to bind to A and B antigens to stimulate the IgM antibodies. IgD are found in the lymph as well as on the surface of B cells as antigen receptors. These are involved in activating B cells. And IgE is a smaller percentage. These are located on mast cells and basophils. These are involved in allergic and hypersensitivity reactions. These also help to provide protection against parasitic worms. Let's talk about that primary immune response. So during the initial infection, there's not very many helper T cells or cytotoxic T cells and B cells for that specific invading pathogen. So this is your body's chance to build up memory, and that's why clonal replication takes place. During this time, special memory cells are made to prepare for a following exposure or another exposure to the same antigen. Secondary immune response is involving those memory cells. In a subsequent exposure to a previously encountered antigen, the response is stronger and more rapid. It's within hours or days sometimes. The presence of these long-lasting cells and antibodies allows for that immunological memory. So this is why when you get a flu shot during that winter or during that year, you will not supposedly be infected by the flu virus, because your body is already has those memory cells that will respond to the flu virus when your body comes in contact with it. This animation here goes through the difference between primary and secondary immune responses. This is showing you the titer, or the antibody concentrations for the IgG and IgM antibodies upon primary and secondary exposure. On a primary response, the very first antibody to respond is, and this is a number of days, after about a week or so, it's your IgMs that build up the tolerance. So your IgMs after about a week are going to be the ones to kill off the foreign body. After the secondary response, your IgGs had developed in response to your IgMs after your primary. So with your secondary exposure, your IgGs are much quicker, and notice how much more of them are produced than the IgMs with that secondary response. So this would be, again, another example would be like getting your flu shot. When you get your flu shot, your IgMs are built up, and that's going to cause a buildup of your IgGs, so that when your body actually does come in contact with the flu virus, boom, your IgGs flare up and fight that flu virus very, very quickly. Let's talk about allergies. Allergies are also known as hypersensitivities. This is an overreaction of your immunological memory. It's a dysfunction of your immunological memory, actually. The individual is initially exposed to an antigen, such as pet dander, food, pollen, medication, peanuts, whatever, the lymphatic system is going to produce IgE antibodies that bind to the surfaces of mast cells and basophils. Those mast cells and basophils secrete histamine, prostaglandins, and other chemicals when your body's re-exposed, which leads to the vasodilation, contraction of smooth muscle, increased mucus secretion, hives, whatever your allergic response may entail. Allergic responses vary from person to person. Some of the symptoms of allergies include the runny nose, the sneezing, the congestion. It could even include difficulty breathing. Anaphylactic shock is another symptom of allergy. This is a severe, life-threatening allergic reaction where the areas constrict so intensely there's extremely difficult breathing that takes place. It's treated by injecting epinephrine, which you recall from the sympathetic nervous system. That's going to cause that sympathetic effect, dilation of airways, strengthen heart contraction, get the blood moving, get the air moving, get you normal again. Let's talk about adaptive immunity. Adaptive immunity can be active or passive. Active immunity is when the body is actually going to develop the antibodies with a direct antigen exposure. It's long-lasting. This would be like catching a cold or getting a vaccination. Passive immunity is when the body receives a pre-made antibody that can be used in defense against the pathogen. This is fleeting, so it's gone when the antibodies degrade and there's no memory cells made. This would be like breastfeeding or getting an antivenom from a snake bite. When you breastfeed your baby, you're giving them your own immunoglobins, your own antibodies. But because the baby hasn't developed the antibodies on their own, they don't have the memory cells. So when you stop breastfeeding or when the child is, 10 years old, they don't still have those same antibodies present inside of them. Let's talk about vaccines briefly. Vaccines can be weakened or dead pathogens. They can be whole or part of an organism. Ultimately, they're meant to bring on a full immune response. T cells and B cells are activated to bring on a full immune response. Ultimately, the whole function of a vaccine is to allow for your body to make memory cells for that pathogen, so that when that pathogen is encountered again, like in the instance of a flu shot, the active secondary immune response is mounted rather than similar to what the primary immune response would be. Some vaccines may need to have a booster to maintain enough memory cells. This would be like the tetanus vaccine. Every 10 years or so, get a tetanus booster. Antibodies offer protection from disease, but if those self cells are attacked, something called autoimmunity results. And there's several different autoimmune disorders that we will talk about throughout this class. Let's talk about some of them right now. Autoimmunity is the immunological response against one's own tissues. So your body is actually attacking itself. It does not recognize itself as part of you. Over 75% of individuals with autoimmune disease are women, usually in the 15 to 45 age bracket. Some of the diseases will occur in men, but if they do occur in men, they tend to be even more severe. Some examples: type 1 diabetes, which is where your immune system attacks your pancreas; multiple sclerosis, which is where your immune system attacks the myelin sheaths of your axons; Graves' disease, your immune system is attacking your thyroid; and lupus is another example of an autoimmune disorder. Let's talk briefly about HIV. Upon infection of HIV, there's no symptoms. The patient will then deteriorate rapidly, and the disease is ultimately fatal. It's present in blood as well as body fluids. The virus is transmitted through the exchange of body fluids, such as unprotected sex or IV drug use with a contaminated needle. The virus cannot survive long outside the body. It cannot be spread through casual contact or insect bites, and it's easily eliminated using heat, disinfection, standard dishwashing, clothes washing will also kill the HIV virus. Why is HIV such a tricky virus? Well, it's because it's what's called a retrovirus, which means it can convert RNA into DNA, and it uses its own RNA to incorporate into the host cell's DNA. It uses a process called reverse transcription. So basically, it is sneaking its way into your cell's DNA, which is why it can kind of hide and remain dormant for a number of years, possibly even your entire life. It can remain dormant for a very long time, or it can force the host helper T cells to make more viruses. Those host cells eventually undergo cytolysis or cell splitting, but new cells are then continuously infected. So the helper T cell count declines, and ultimately you're going to have a suppressed immune system because your body no longer has helper T cells available. The initial HIV infection presents like the flu. The virus then spreads throughout the body. Then there's a latent period where the T cell count is stable but a little on the low side. Once that T cell count drops, however, the infected individual is then unable to respond immunologically. Now the classification becomes AIDS, or autoimmune deficiency syndrome. In this case, the body is unable to fight off something as simple as a cold or the flu. AIDS, acquired immunodeficiency syndrome, is when the HIV infection induces a condition where that patient has the destruction of the helper T cells, persistent fatigue, weight loss, enlarged lymph nodes, night sweats, rashes, diarrhea, lesions, and ultimately death from the opportunistic infections can ensue. HIV patients, if left untreated, will show AIDS symptoms within 10 to 12 years. Untreated patients with AIDS can die within 8 to 12 months. There are pharmacological therapies that are available to provide an extension of life, but there is no cure. HIV is a lifelong disease. There are some therapies that have been proven somewhat effective. There's reverse transcriptase inhibitors. These are going to block the action of that HIV reverse transcriptase enzyme for making the copies of DNA. There's also protease inhibitors, which block the actions of HIV protease, which allows that HIV DNA to cut the host proteins into pieces to assemble the HIV virus. There's also something called HAART, highly activated antiretroviral therapy. This uses a kind of cocktail, a combination of two different reverse transcriptase inhibitors and one protease inhibitor. It's very expensive, but very effective. It's ultimately going to reduce the number of HIV viruses in your body. It's going to increase the number of helper T cells. It's going to delay the progression into AIDS. It may cause remission or the disappearance of opportunistic infections. This diagram here goes through the main symptoms of AIDS, including fatigue, headache, rash, sore throat, joint pain. This diagram here shows the slowly disintegrating T cell count. That's this red line, or rather green line. I know my colors. This green line here. The red line is showing you the number of RNA copies. So in other words, as the T cell count declines, the number of RNA copies increases, which ultimately means the number of HIV viruses increase. Treatment, as I mentioned, those reverse transcriptase inhibitors and protease inhibitors are the two kind of molecular pathways that are being researched. And that concludes